Welcome to Prescribing Lifestyle, the podcast that's all about empowering you to live your healthiest, happiest life. I'm your host, Dr. Avi Charlton, and each week we'll dive into the latest research, practical tips, and inspiring stories to help you optimize your well-being. From nutrition and fitness to mental health and mindfulness, we'll explore every aspect of lifestyle medicine, giving you the tools you need to make informed decisions and take control of your life. Today, I have for you the recording of my talk from the Low Carb Dinner on the 18th of May 2024. I talk about the top 10 tips for thriving on your low carb journey. I will give you a few tips on managing your mindset, trying to help you think that you're not missing out, and how to maintain on sustaining this fabulous lifestyle and trying to change your mindset. I hope you enjoy this episode. Hello, welcome to another episode of Prescribing Lifestyle. Today we're going to have a sweet talk, navigating the world of artificial sweetness. I'm going to introduce you to the world of artificial sweetness. I'm going to give you the information so you can decide if you want to sweeten your food with these artificial sweetness. We're going to briefly talk about sugar and fructose and the different names of sugar and fructose. We're going to talk about different types of artificial sweetness and the natural sweetness. And I'm going to give you some practical suggestions on how to navigate it. And then you can decide if you're going to go with the artificial sweetness or natural sweetness or not. Before we go into the artificial sweetness, let's just briefly talk about sugar. Beware of sugar. There are so many names. There are over 50 names of sugar. It can be called brown sugar, caster sugar, demerara sugar, fruit juice concentrate, date sugar, corn syrup, lactose, icing sugar, sucralose, rice syrup. They are all sugar. They are just different names of them, just trying to trick you. So just be careful. Even if it's maple syrup, agave syrup, coconut sugar, they are just different names of sugar and have different percentages of fructose and glucose. So your table sugar, one sucrose, has half glucose and half fructose. If you have honey, it's got a little bit more fructose. It may have some minerals and vitamins like vitamin B6 and niacin. However, it's got lots of fructose as well. Maple syrup is just fructose as well. There's lots of dangers of fructose or even high fructose corn syrup. Fructose is also found in fruit, and we thought they are good for you. But fructose actually increases your risk of weight gain, obesity. It increases your insulin and increases your insulin resistance, metabolic syndrome, and eventually type 2 diabetes. It also increases your risk of heart attacks and cholesterol, such as increased triglyceride. Fructose is only broken down by the liver. So it stores as fat and becomes fatty liver or non-alcoholic fatty liver disease. It also affects your gut health by negatively impacting and promoting harmful bacteria and disrupting the balance of good bacteria. So be careful of fructose. Don't think they are just fruit, just natural. Now we get into the artificial sweetness. So there's a bit of a history with the artificial sweetness. Before the 1900s, in 1800s, this scientist called Konstantin Feldberg, who's a chemist, accidentally discovered saccharin. He was working on coal tar derivatives in Johns Hopkins University. Suddenly, he tasted a sweet taste in his hand while he's working with chemicals. And he found this chemical sweet. He called it saccharin. As there's a second artificial sweetener called aspartame. This scientist accidentally discovered this aspartame whilst working on anti-ulcer drug. And then the history of sucralose is there's two scientists called Tate and Lyle in Britain. One of the scientists misheard the other and thought he said, test the chemical, and he actually tasted it. And he found this compound to be exceptionally sweet. These artificial sweeteners, the list includes sucralose, aspartame, acesulfame potassium, neotame, saccharin, and these are often found in diet drinks, Diet Coke, Pepsi Max, and sugarless tablets like Equal or sugar-free jelly, sugarine sweetener tablets, diet ginger beer, Splenda, and even in protein bars. That's lots of artificial sweeteners. So these artificial sweeteners, the FDA have sort of ruled out cancer. There was some suspicion that these can increase the risk of cancer. However, there has been the history that maybe they might have caused brain cancer and bladder cancer in rats. So in human, the studies may be done by industry, like the sweet food industry, have sort of ruled out cancer. However, some scientists have said that these sweet tastes have still increased some people's insulin, increases the risk of insulin resistance. It can affect your gut microbiome. Some people report that these sweeteners can cause gas and bloating and diarrhea. And in some rat studies, it can affect the growth and cause anemia, affecting the red cells. So be very, very careful when you go with these artificial sweeteners. They are not natural, and we have to question these studies. Some studies have found that having artificial sweeteners can stop you from losing weight because it maybe affect your gut microbiome. So just be careful with them. The next group of artificial sweeteners we talk about is the sugar alcohols. The sugar alcohols include erythritol, laxitol, mannitol, sorbitol, and xylitol. Be careful with xylitol, especially with dogs. It is toxic in dogs, so I've stopped buying them because I have a couple of dogs. The sugar alcohols isn't as sweet as the artificial sweeteners. Some can be found naturally in fruit and veggies. However, most in the packets are actually processed. They do have calories, but not much. There are lots of people that actually report bloating, gas, and diarrhea with having too much xylitol or erythritol. Especially those people who want to participate in low FODMAP diets. These sugar alcohols actually is the P in the FODMAP called polyols. So it can increase your bowel symptoms and cause gastrointestinal side effects. Last year, there was a study in 2023 that has warning about erythritol, warning that it might increase your risk of heart attacks and stroke. However, we have to be careful with these studies. This is an association study. It wasn't a randomized control study. This study didn't look at the diet of these people. Were these people eating a good diet or these people eating a standard diet? And it just measures the amount of erythritol in your blood glucose. So just be very careful when interpreting these studies. Then there's the next type of sweetener, which is actually natural, called stevia. Stevia is derived from plants. It's okay for teeth and it can be found in chewing gum. Some people have found it causes an aftertaste that's a bit bitter. Sometimes when you buy it, it can be mixed with other sweeteners like maltodextrin, which is the filler, and it can affect your gut microbiome. So just be careful with it. It's regarded that stevia doesn't increase your insulin. Monk fruit is a new one, which is a fruit derived from a natural fruit found in Asia. It's generally regarded as safe and it doesn't increase your glucose and insulin. However, just be careful with the monk fruit that's found in the market, especially like Lakanto. 99% of the Lakanto is erythritol and only 1% is monk fruit because monk fruit is actually very, very sweet. And the manufacturers worked out that to make it similar to the sugar sweetness, they have to add lots of erythritol. There is a new kid on the block called allulose. Allulose is very, very low calorie. It doesn't rise your blood insulin or glucose. It can be naturally found in fruits such as raisins, figs, and maple syrup. It doesn't cause any tooth decay. Maybe it can cause gastrointestinal side effects like bloating and tummy pains. However, some scientists have found maybe it can cause GLP-1 inhibition, just like the drug Ozempic. It can be anti-inflammatory, and some scientists have started to investigate maybe it has anti-cancer effects. I'm not sure. However, this is not food, so you have to be careful with it. I'm going to give you some practical guidelines. Myself, I wouldn't touch artificial sweeteners, including the diet drinks, the jellies. If I'm going to eat it, only very, very occasionally. They are not food, and it can be toxic. We don't know the safe amount. It is tested to be regarded as generally safe. However, who's running those studies? Sometimes I have a little bit of sugar in terms of an 85% dark chocolate. The safer natural sweeteners include stevia, monk fruit, erythritol, and allulose. I'm usually okay with those, and if I was to bake something, I'm quite happy with baking with monk fruit and erythritol. However, I make it a very occasional occurrence. Because sometimes if you have something sweet, it can stir up your cravings. If you have a little bit, it's hard to regulate and you want to have more sweet things. If you bake a sweet keto cheesecake, you can't stop at one slice and you want to have more. And be careful, these are not foods. The more sweetened foods you have, just like the protein bars, or they are actually processed foods. So the more sweetened food you have, the less real food you have. They can be an exemption and just occasional food. If you're going to have a sweet drink, water is the best. If you want a little bit of bubbles, you can have a bit of soda water with like a fizzy mineral water, sparkling water, with a little bit of lemon or lime, which is a bit safer than artificial sweetener. Just because it says it's a diet product doesn't mean you can have twice as much of it. Having diet drinks also might make you have more food. So be careful with artificial sweeteners. It doesn't mean you can have a lot of it, and the studies may not be conclusive. In 10 years' time, we might have more studies coming out. However, you have to look at who funds the studies. I hope this episode of Prescribing Lifestyle has been helpful for you. Leave me a comment, follow me on social media, and direct message me. For more information, follow me on more episodes. Until next time, let's talk about lifestyle and concentrate on being healthy. Thank you. Bye. Thank you for tuning in to another episode of Prescribing Lifestyle. We hope you found today's discussion insightful and motivating. Remember, your health journey is a marathon, not a sprint. Implementing small, sustainable changes over time can lead to sustainable improvements in your well-being. Remember, these podcasts are not to be treated as medical advice. You should see your own doctor for medical treatment, or you can come in to see me in my clinic in Melbourne Low Carb Clinic, face-to-face or telehealth Australia-wide. If you have enjoyed today's episode, please subscribe, rate and review us on your favorite podcast platform. Your feedback helps us reach more listeners and continue bringing you valuable content. I also want to invite you to head to the website of Melbourne Low Carb Clinic to download a free ebook and join my free community on Facebook. Stay connected with us on the socials. And don't forget to share this podcast with your friends and family who might benefit from our discussions. Until next time, keep prioritizing your health and embrace the power of lifestyle medicine. Take care and see you soon on Prescribing Lifestyle.